are you today? Good. All right, perfect. Well, my name is Cassie. I'm your nurse today. Are you Moxie Java? Yeah? Okay, perfect. Do you prefer Miss Java or Moxie? Moxie? Okay. All right, well, if you have, today I was told, doctor's orders, we're going to go ahead and put an NG tube in. What that does is we're going to put a tube and go down through your nose and into your stomach. Kind of try to relieve some of that pressure you got down there, okay? All right, perfect. So I am going to ask real fast, will you go ahead and give me your full name and your birthday? Perfect. Okay, so I'm going to wash my hands and then we'll get started, okay? Are you still feeling all right? Okay. Have you had any real pain lately? Not much. Well, on a scale from 0 to 10, 0 being no pain, 10 being like the worst pain ever, how are you feeling right now? Like a 1? Okay. Is that about normal? Yeah, more just uncomfortable, not so much in pain. All right, perfect. All right. Let me finish putting on my gloves here. Alright, so I'm going to go ahead and auscultate your belly. Just go ahead and give a little listen to. So I'm going to have to go ahead and expose you a little bit here. I'm going to go ahead and raise your whole bed up a little bit. Your bed cooperates. Oh, give me 1 second here, ma'am. Okay, so I'm going to give you a listen. All right. So you let me know if you're feeling uncomfortable or anything, okay? All right. Some good sounds in there. I'm just going to go ahead and fill your stomach real fast. Any pain or anything anywhere where I'm touching you? No? Okay. Alright, so I'm going to go ahead and cover you back up. Alright, have you ever had an NG tube put in before? Oh, you have? Alright, perfect. Alright, so I'm going to go ahead and I'm going to raise the head of your bed now. Maybe. Or it's going to raise your feet. Alright, you're doing great. Alright, perfect, okay. Make sure your feet are lower there so you're not too uncomfortable. Perfect. I'm going to raise some of my stuff over here real fast. Okay. So I'm going to go here and take a look in your mouth. Can you say ah? Perfect. Okay, I'm just going to go ahead and get a little look in your nose. All right. So I'm going to ask you here. Can you go ahead and blow your nose for me? perfect. All right. So I'm just going to drop your bed back down and go throw this away. And then I'm going to wash my hands and change gloves real fast. All right. So I'm going to go back over here. Are you comfortable like that, or do you need me to lower? You need me to change your head of your bed? You're okay. All right. Perfect. So I would wash my hands. Some gloves on. All right. I'm just about to get ready to get really started here. Okay. So I'm going to raise your bed back up. My supplies out of the way. All right, perfect. Okay. You go ahead and just breathe normally, but I'm just going to check your nostrils real fast. All right, go ahead and breathe and do with that one. All right. So what I'm feeling here is what I believe is that you can breathe better out of this one, out of your left nostril. Is that what you're feeling too? All right, perfect. All right, so we're going to go ahead and start. I'm going to put the tube in that side. So I'm going to go ahead and cover you up with this. Can get kind of messy sometimes. I'm going to raise the head of your bed up a little more for the left. I know it's kind of uncomfortable for a little bit. But we got to have you up nice and high so we can get it in. Alright. Alright. I'm going to give you this just because it will make you kind of it can make you nauseous sometimes and make you not feel very good. If you do come at any point into a lot of pain or you want me to stop, just go ahead and raise your hand and I'll give you a second, okay, before we keep going. Alright? Alright, so I'm going to go ahead and finish getting all my supplies ready. Get this. Alright. Maybe. There we go. Oh my gosh, it sticks to your gloves a lot. This is fun. There we go. Okay. Alright. Have you ever had a deviated septum or a broken nose or any problems like that? Or any nasal surgeries? No? Okay. So you feel pretty good. So I'm going to go ahead and I'm going to start here by measuring my tube here. I'm going to go from your nose to your ear. Let's see if that's like that. Okay. And then we're going to go, I'm just going to uncover you real fast. So nose to ear, and then from your ear down to your xiphoid process. Perfect. There, about 55. I'm going to put a little piece of tape here so I know where to go. Maybe if it'll stay off my gloves and onto the thing. Perfect. Okay, so now I'm going to cover you back up here. Okay. This gets kind of stiff, so I'm going to loosen it up a little bit so it won't be so tough going down your nose. Alright, so I'm going to go ahead and put it in now. Remember, if any time it hurts, just raise your hand. I am just going to put it down just so past your throat for now. Okay, so if you feel anything or need anything, let me know. Alright, so I'm going to go ahead and I'm going to ask you just to tilt your head up and back for me. I'll even squish the pillow down a little bit. Alright, so go ahead and tilt your head up. Thank you. Alright, here we go. So I'm just going to go ahead and take a little look here. You don't see any coiling or kinking. Alright. So, at this point, I'm going to give you some of this. You're NPO, so you can't have anything to drink for real. But if the whole motion of swallowing helps it go down easier, so I'm going to let you take a few sips of this. Just kind of air sips if you need them. If not, go ahead and just do it on your own. When I go ahead and say take a sip, then go ahead and I will advance a little bit further and we'll try and get this done as soon as possible, okay? Alright, so go ahead and sip. And sip. Sip. Perfect. One more. There we go. One more time. Sip. Perfect. Alright, sorry there, I got you in the eye a little bit. Set that right there. Alright. Actually, I'm going to take this off of this real fast so you don't have this uncomfortableness there. Maybe you'll stick to my glove and not your tube. Sorry about that. I know it's a little uncomfortable here in this whole situation. So I'm just going to hold that there, stick it to my glove. I'm going to go ahead and I'm just going to attach this to your cheek. Okay? There we go. It's kind of a big piece of tape, but it won't be on there too long, I promise. Alright, you still doing okay? Alright, perfect. Alright, so now I'm going to go ahead and I'm going to make a little mark on your tube so you know where it's coming out of your nose. Alright, are you still doing okay? Perfect. Okay. So now I'm going to go ahead and I'm just going to put it up here. I'm just going to pull out a little bit of fluid. Perfect. Alright. Leave that back there. And cap it. Alright, so I'm going to go ahead here. Alright, looks like you have a stomach pH of 3, which is good because you have been NPO for a little while. So I'm going to go ahead and I'm going to fasten this to your nose so we can get that off your cheek and we'll get you all hooked up. So I am going to start and I'm just going to put this one on your nose. Right there. Okay. Alright. How's that? You alright? Okay, perfect. Alright, I'm going to take this off your cheek real fast. Hold on, make sure it doesn't come out. So we don't want to start over. We don't want to take it out and start over, huh? Are you still doing okay? Yeah? Alright, perfect. Alright, so let me get this out of your way real fast. Take this over here. Alright, I'm going to hook this up. And we're going to do is we have you on low intermittent suction right now, okay? The doctor's ordered, so that's what we're going to hook you up for. Turn it on right after I get everything all set up for you. So now I'm going to attach it to your shirt. Can you go ahead and look that way for me? Perfect. Okay, you can turn around now. I just want to make sure that if you turn your head, you don't have to worry about it getting all tangled up. Okay. Give me just a second here, ma'am. This pin has got some tape on it stuck to my fingers. you still doing okay? No pain? Perfect. All right, so let me get all my area cleaned up here. Okay, I'll take this to the linens. Got your suction all turned on. Go ahead and lower your bed. You're very good. All right, now since you are NPO, I can't give you, you can't have anything to drink, especially while it's in. And because the tube's in, I can't lower your head all the way down, but I can lower it a little bit. Is that all right? Perfect. Okay, so we can get you all adjusted there and comfy. All right. So I'll go ahead and get all this cleaned up, dispose of everything in the biohazard bin or in the linens, wherever it needed to go. All right. Well, here's your call button. If you need anything else, feel free to let me know. Someone will be back in to check on you a little bit and check out and see how your tummy's doing. All right? You have a great day.